Taoiseach, I want to raise with you today the appalling length of the waiting lists and waiting times for patients across the country in our hospitals. The situation is truly scandalous and is unacceptable, and particularly for children who are waiting far, far too long to get to see a consultant in our three national children's hospitals, particularly in Crumlin and in Temple Street. And I think you can trace it back to the decision of the then Minister James Riley back in 2011 to essentially mothball and destroy the work of the National Treatment Purchase Fund. Because at that time, just prior to that, the average waiting times for elective patients was about 2.5 months. And so it's for people waiting for elective treatments. He changed the system, it's all documented, and it's been all downhill since, with dramatic increases in waiting times and in the waiting lists. We now have 415,000 people waiting for outpatient appointments, for example. 62,000 people waiting longer than 1 year. We have over 75,000 people waiting for treatment in hospitals for inpatient treatment. 4,500 children are waiting for appointments in the three children's hospitals, and of those, 2,000 are waiting for more than a year. And one would think that when it comes to children, that we should be moving might and main to eradicate those waiting times and to shorten them dramatically, particularly in terms of those waiting longer than a year. And the programme for government talks about progress and sustaining progress made. I would suggest that it should take out the language of sustaining progress, because no progress has been made over the last number of years in terms of waiting lists. In fact, the situation has become dramatically worse. The waiting lists are now up 45% in 2 years. 45% in 2 years. And I think it really is a very sad indictment of what's been going on over the last 2 to 3 years in terms of policy, initiative, and a lack of basic urgency in terms of dealing with this crisis. People should not have to wait that long to get to see a consultant, and children in particular shouldn't have to wait that long to get to see a consultant. So I would ask you, Taoiseach, there is a commitment to re-establish the Treatment Purchase Fund, and there's a commitment of 15 million. Now, I would first of all say to you, I don't think the 15 million will be enough. There's a wider commitment of 35 million or 50 million overall in terms of waiting lists. But can you outline to the House the plans that you have, Taoiseach, in terms of reconstructing and re-establishing the Treatment Purchase Fund back to the model that was in existence before James Riley mothballed it, so that it would be effective and have the capacity to deliver the results? And do you accept, Taoiseach, that these waiting times are absolutely unacceptable to the patients concerned? Taoiseach.
Except that any waiting list is never satisfactory because of the person who has to wait, the patient involved here. The programme for government, as Deputy Martin pointed out, does emphasise the need for a sustained commitment to improve waiting lists for patients, with a particular focus on those who have had to wait the longest and are waiting the longest. And the Department of Health will engage with the National Treatment Purchase Fund to deliver on that 15 million funding for an initiative targeted at those waiting longest, as part of a continued investment of 50 million a year to deal with waiting lists. And I understand that the Department is currently engaged with the National Treatment Purchase Fund, and the HSE is planning a dedicated waiting list initiative which will be rolled out later this year at Cancora. The issue really for patients is how long they have to wait. Now, improving waiting times for scheduled or for planned care for patients is absolutely key in this. And the action taken by the previous minister did result in improvements. In 2015, 51 million extra in additional funding was provided to address maximum waiting times of 18 months by the 30th of June last, and 15 months by the year end. That these will be achieved for inpatient, for day and for outpatient cases. The end of 2015, just last year, showed a 95% achievement for inpatient and day case waiting lists, and a 93% improvement for outpatient waiting lists against the 15 months maximum wait times. And this year, 2016, the HSE service plan undertakes to maintain the 2015 levels of service in respect of scheduled care. And in 2016, also this year, the HSE's Scheduled Care Governance Group is focusing on a number of key areas, and they are, Ceann, ensuring that that the chronological scheduling of cases is adhered to, putting in place validation procedures to ensure that patients are available for treatment when they are deemed to be for treatment, and relocating high-volume, low-complexity surgeries to smaller hospitals. Many consultants say to me they could do more work if work was shifted to smaller hospitals that is of a lower complex order. And fourthly, designating an improvement lead for each hospital group to provide support in meeting the national targets, both for appointments and for treatments. So I'd point out to Deputy Martin that 800 million extra has been put into the health system because the state of the economy has improved. That in turn will lead to improvements in a number of sectors, and clearly that money wasn't available before to deal with these very necessary cases.
Thank you, Deputy Martin.
Taoiseach, that's not the case actually. James Riley changed the policy. He got rid of the treatment purchase fund, which was a singular, dedicated, focused approach to dealing with waiting times, and he blew it, and he got it terribly wrong. Minister Varadkar came after him, showed no urgency at all in relation to this. I mean, in Beaumont now, for example, there's 5,000 patients waiting. That's up 57% on January of this year. So I think the government needs to do a real check on reality and not quote the kind of figures that I've just quoted, because of course what James Riley did, he created a new target, 12 months, plucked it out of thin air. Up to then the target was 6 months for adults and 3 months for children. And James Riley comes along and says it's now 12 months.
Question, Deputy,
and Ms. Barker said it's 15 months. So then you start judging yourself against new targets that you created. This is very urgent. In terms of the number of people that have to wait. In Crumlin Children's Hospital, 2,000 children have been waiting for more than a year for an outpatient appointment. That is not good enough, and we should immediately tackle that with a sense of urgency that's followed up by real money, not later in the year, but right now, to get to the bottom and get those lists taken up. Waterford is up 183%, Taoiseach. Since January. Waterford hospitals, second worst in the country. CUH up 1,182, 4,000 people waiting. It's unacceptable. I would put it to you, Taoiseach, that it needs dramatic, urgent action by the Minister and a proper re-establishment of the treatment purchase fund. To have a dedicated approach to getting this issue sorted, because it's getting worse as time goes on.
Well, as I said to Deputy Martin, the original allocation included 300 million extra for health. That's been adjusted with a further 500 million. The National Treatment Purchase Fund was an issue that was discussed between the two parties in respect of the formation of government, and you yourself, in fairness, had made a point that the National Treatment Purchase Fund should be restored, and it is being restored, and the discussions are on at the moment between the HSE and the National Treatment Purchase Fund for the rollout of treating people on a dedicated waiting list, and 15 million allocated for it this year. Obviously, any figure is never enough when you compare it to the requirements in health, but there is a need here for outcomes and for results. And obviously, the National Treatment Purchase Fund is being replaced now, being put back in situ. The discussions are on between the HSE and the National Treatment Purchase Fund for an initiative that is targeted at those who are longest on the waiting list.
Thank you,
and I hope that will produce good results for those patients in the very near future.
Thank you very much.